Hello, everyone. Thank you for joining us today. My name is Juan Espinosa, Director of Student Success here at the UCLA School of Nursing. And today we're very excited to open up our Alumni Lecture Series program with Alex Tchekanov. BS Alumnus Class of 2023. Alex is originally from San Diego, California. He earned his Bachelor's of Science in Nursing from the UCLA School of Nursing in 2023. During his time as a student, Alex demonstrated exceptional leadership as the president of the Professional Nursing Fraternity, ATB, vice president of Men in Nursing, and as a representative of the class of 2023, but he also had the honor of serving as the graduation speaker. Additionally, he founded the inaugural School of Nursing yearbook, which has since become an annual tradition. Following graduation, Alex began his nursing career at UCLA Ronald Reagan Medical Center, where he completed a new graduate residency program in the cardiac intensive care unit. With a year of experience as a registered nurse, Alex is now dedicated to mentoring aspiring nursing students and residents, sharing his passion and knowledge to inspire the next generation of healthcare professionals. All righty, take it away, Alex.
Awesome. Thank you so much, Juan, for the great introduction. Hello, everyone. My name is Alex. I hope you like the dinosaurs on my presentation. All right, so to get started, a little overview of what we're going to talk about in this presentation. First, I'll introduce myself. We'll talk about the cardiac thoracic ICU that I currently work in. And then I'll go through a couple of tips and tricks for nursing school, NCLEX, the whole type of thing. So first off, who am I? Who is this dude talking to me? Why is he giving me advice? Juan already gave a great introduction, but I graduated last year from UCLA, so I'm exactly where you are right now. I used to be there studying, same classes, same professors, in a lot of clubs, and I was also part of the UCLA Salsa Society Club. Very average member. Didn't learn the most, but it was still fun. This is me holding pizza, the classic nurse pizza party. All right. But actually, who am I? Just a regular dude who went through what you're going through, who wants to help out. Nursing school can be difficult. It can be stressful. There can be a lot of questions. I know I had a ton of questions, and I think it's just helpful to have someone who's easy to talk to, who's not going to judge you, who can kind of guide you through the steps to get to where you want to be. In my free time, I have a lot of hobbies. I like slack grinding, I juggle, I surf, do a lot of rock climbing. I've recently tried to get into cooking a little bit. That also hasn't been super successful. So if you have any good tips or got a more beginner-friendly cookbook, I would appreciate the recommendation. All right. All right, CTICU. So what is the cardiothoracic ICU? This is a very specialized ICU in the hospital. UCLA Ronald Reagan has a lot of specialty ICUs. They have a neuro ICU, they have a liver ICU, they have cardiothoracic, yada yada. But specifically this unit, it's heart transplants, lung transplants, cabbages, which is a coronary artery bypass graft. There's valve replacements, ECMO, and a ton of stuff. To walk through these, like our unit really focuses on I guess you can't see me in the Zoom, but your chest area, your thoracic area of your body. So a lot of it is like mid-sternal incisions where they open up the chest completely, and during surgery, they're performing operations in that area. One of the really cool things you get to work with are ECMO patients. ECMO is basically life support. It's these two really big IVs go either in both your femoral fins or in your neck, and this pretty much circulates your blood for you, or pump your blood for you. It can also oxygenate your blood for you. And a lot of times these machines are used for a bridge to recovery. If a patient needs time for their lungs to catch up or for their heart to get better from their disease. It can also be a bridge to transplant. So for example, just making sure patients stays alive and can be okay until they're eligible for a heart or a lung or until one becomes available. And so I started here as a new grad, and I was very fortunate that during my senior year, I was able to do my immersion here. It was really cool to meet all the nurses. Everyone was super kind, super helpful. There's sometimes a stigma around like the CTICU is like, oh, everyone's super mean, or like the nurses think they're young, and like that's a stereotype in a lot of nursing, where like the older nurses kind of like make it difficult for the newer nurses.
Really? Oh, wow.
Yeah, but not at all on
You
this
haven't seen
unit.
that?
Yeah,
Oh, good. That's good.
yeah, and like a lot of like my friends who've also graduated with me who work at UCLA, they haven't had that experience at all. Everyone's been super kind, super helpful, and I'm sure through your own rotation so far, if you've started them already, you've met some pretty cool nurses. Um, Also, as a new grad, it was cool because they really helped out making it easy. UCLA has a very nice new grad program that kind of transitions you into practice. Um, and one of the things I remember they talked about in nursing school was you're never going to truly feel confident or comfortable until like 6 months to a year in. And I remember I was like, oh, I'm a good student. Like, that's like, whatever. I'm going to be fine. I'm going to walk into there and be okay. Um, but no, the first 6 months are hard. There's definitely a learning curve. Um, and nursing school is awesome. It teaches you a lot. It really gives you a foundation. But I think the most of your learning is on the job. It's when you first start. Um, and it's all on like your preceptors who are guiding you. See there's something in the chat. Oh, thank you, Juan. um, and yeah, so back to the unit, it can get pretty intense. We do have our own code team. So usually in the hospital, if there's a code, they'll call it over the overhead and people will come and respond. However, in our unit, because we're very specialized and we have different procedures, I guess, for our codes, we don't call it over the overhead, and we go ourselves with the nurses, the nurse practitioners, and the attendings. There's a lot of critical thinking. It's very fast paced. We have a lot of monitors and numbers that we're assessing throughout the whole shift. And in the next section, I'll talk more about some of those specifics. Also,
What would you say is like the most challenging part of the development so far in this area? Or something that you maybe didn't think that about? Or...
Yeah, it's a good question. I think the hardest part was just the initial learning curve. Like I said before, nursing school really gives you foundation. You do learn a lot of really good information. But specifically for the cardiothoracic ICU, it's kind of all your like med-surg C content. And you only have one class with that, and you don't necessarily go into all the details of different central lines, swan guns, chest tubes, and everything. So the initial learning what everything is was difficult, and then learning how to apply that into your practice and like how to respond to things. But like everything, it just takes time. Got a lot better. And then for anyone else, if you have any questions, like feel free to pause or to raise your hand, send in the chat. But there'll be time at the end for questions too. Okay, so I originally had a hands-on section, but since this is all Zoom, I might grab this up and kind of show you on the camera.
Yeah, you can do this one if I...
Okay. All right. So first prop I brought, this is our healing teddy bear. It's a weighted stuffed animal, which is really, really cool. Because most of our patients have a mid-sternal incision right here, the sternum cut wide open, and so it can make it very difficult to take deep breaths, or it can make it very difficult to turn. And so we give the patient the hole here, and they squint, and so they squeeze it nice and tight, so that when they're turning, it kind of protects that area. It's also a pretty cute bear. A lot of our patients name them like different fun names. I've had some of my patients name after their doctors, which I think is really funny, like their surgeons.
Do they get to keep the bear when they leave?
Yeah, they get to keep the
Oh,
bear.
wow.
Yeah, so it's really fun. We also have, this is a swan gums catheter. You'll definitely hear Professor Klinka talk about it. She loves these. She talked about it in her, when I was in her class. So what is this? It looks pretty wild, right? There's sort of new ideas, right? IV goes into your vein, you get blood through it. Now imagine an IV that goes to your neck. This IV goes all the way to your heart, and that's the central line. So remember, the regular IV goes to your neck, your heart, central line. This big yellow thing with all these connecting ports goes through that IV, goes around into your heart also. And so this part of the catheter sits in different areas of your heart and can measure different pressures. And because we're a cardiac ICU, it's very important to be able to measure the pressure in different parts of the heart. How does it do that? It has all these cables on the end that look kind of intimidating and scary because there's so many of them. But pretty much these all just connect to different monitors that will give you the numbers that are getting from the end of it. Wow. Pretty cool. It's very important for these. You have a lot of safety checks to do to make sure it's blocked, make sure nothing's coming out. Some of them also come with like an IV section, so you can push medications through it. Wow. And there's different variations of them. Some of them have different monitoring sections. But
That's connected to the heart.
so yeah, the side goes from your vein in your neck all the way into your heart.
Oh, wow.
It goes into different parts of your heart. You get different numbers. So they're super important. Almost all of our patients have them immediately after surgery. It's really cool. And then next I have this. This is in a balloon pump. And so the way this works, this goes into your groin, also goes all the way up into your heart. And what this does, this helps with coronary artery fatigue. So what is that? So arteries are they're like veins, but veins return blood to your heart. Arteries take blood away from your heart to get oxygen to your organs, to your tissues, and everything. Your heart itself has its own arteries, because the heart needs blood flow to like get oxygen, to be healthy, to pump. And a lot of times, if you have like clots or something that can be blocking perfusion to your heart, it can be pretty bad. And so what this does, this part of the catheter is a balloon. And so it's going to sit in the aorta right above the heart. So when the heart is pumping blood, it's going to go through your aorta out to the rest of your body. What this does is that, let's take a step back, the heart has two things. The systole is when it squeezes and sends all the blood out. Diastole is when it relaxes and the blood kind of fills in the heart. So what this does during diastole, when the heart is relaxing, filling up, getting ready to eject blood again, this balloon will fill up. What this does, it puts pressure back onto the heart to push the blood into the coronary arteries to perfuse the heart. And then when the heart is ready to squeeze again to send all the blood out, and it deflates, causes negative pressure to let it be easier to send all the blood out. We don't have a lot of these on our unit, but we do have them every once in a while, and they are one of the many devices we have. We have tons of devices. We have ECMO, like I mentioned. We have swans. We have balloon pumps. This isn't necessarily a device, but this is an ambu bag. You should all be familiar with this. This is very important in emergency situations, especially in a code when you have to bag a patient. Put this on patient's face. I'm sure you've all seen it before. And then I have one more thing I'll share with you guys. This is a chest tube pleurovac container. So pretty much, you have another slide on it. Let's see. Okay, chest tubes. So I remember being super confused about chest tubes in nursing school. This is something that's on the NCLEX. There's some very specific questions about it with the bubbling and like all that stuff. So I thought it'd be cool to go like super quick rundown of it. What is a chest tube and where does it sit? So chest tube is a tube that goes in your chest. There's two types of chest tubes. There's a mediastinal chest tube and there's a pleural chest tube. So the picture here in the middle is probably the easiest to understand first. Your pleural space is the space in between your lungs and the ribs. This area can be filled with fluid, be filled with air, can be filled with blood. This is all depending on the surgery, the disease, and the situation. Mediastinal is the area in between the lungs and the heart. And the chest tube can kind of go anywhere there based on what's needed and where the fluid is. Almost all of our patients after surgery come with these chest tubes. It's just natural to after surgery to have some fluid or some blood come out post-op. And we just wait till fluid starts dwindling, it's not as much, take out the chest tubes. This is a picture of the one that we use. And so the actual one here, I'll show you. This is the section where the blood or the fluid will come in. This is a chamber right here where it's going to be measuring the water levels. And this here, this number is where you control how much suction is going to be sucking the from the chest tube.
And what is the function of this again?
So it's to drain any extra fluid, blood, or like air where it's not supposed to be. It's just to help establish normal pressures in the chest. And it's very, very common on our unit just post-op because there's always some sort of bleeding afterwards because they're cutting into your chest. Right? Mm-hmm. With that, there's this quick YouTube video. It talks about like bubbling with the NCLEX. I'm gonna share just like 2 minutes. I'm gonna share.
Now for air for the pleural chest tube. Now for chest tubes. As you know, chest tubes are used to drain fluid, blood, or air from the pleural space within the lung in order to re-expand a collapsed lung. And so the main purpose is to restore a normal negative pressure within the pleural space. Like with a pleural effusion, where we have fluid in the pleural lung space, or a hemothorax, that blood in that pleural lung space, and even pneumothorax, that air inside that lung space. Now, how does a chest tube work? Well, by inserting the tube into this pleural lung space, it simply sucks out that air, fluid, or blood into a closed, one-way drainage system. So naturally, we must keep the drainage system below the chest level to help with drainage. So Hezi mentions this, asking interventions for a client with a chest tube or a pneumothorax. The answer is to keep the drainage below the chest level. Yes, gravity helps with drainage. Now for chest tube care, the 3 chambers to know for your nursing exams and the NCLEX is number 1, the suction control chamber right here. Number 2, the water seal chamber that also has an air leak gauge right here. And 3rd, the collection chamber to measure output. So starting with number 1, the suction control chamber. Key terms here, write this down. We want to see gentle, steady, or key terms, continuous bubbling. This means we have a good amount of suction being applied, especially with clients with a pneumothorax, that air inside the lung. Again, gentle, continuous bubbling means the chest tube is working, not vigorous or violent bubbling. This means that the suction is too high. So the memory trick we use, just think of a child sucking down a milkshake in the suction control chamber. We want gentle, continuous bubbling, not vigorous or violent bubbling, just like the milkshake. Vigorous bubbling is not good and could get a little bit messy. Next, we have the water seal chamber and air leak monitor. This guy acts as a one-way valve to help drain air and fluid from the lung and also prevents air from entering that chest cavity. Now, it's good to see a steady rise and fall with breathing. This is known as idling, and this is good. It means that the system is working correctly and keeping that negative pressure, naturally rising and falling with each breath. And this will naturally reduce as the lung re-expands. Now, continuous bubbling is very bad. Typically, it means that there's an air leak inside the system. But we'll cover this more in detail in a moment. So the memory trick, just think of a seal inside the ocean or the water seal. This seal floats up and down with the tide of the waves, nice and even every time it takes a breath. So this is tidalling, that rise and fall with the tide. Now, a big no-no is we never want this seal to be blowing continuous bubbles under the water. So just think of a lifeguard saying, hey, no bubbling in the water, you seal. Thanks for watching.
I don't know how great his memory tricks were, but that's kind of the basics. I think the big thing is on NCLEX, there will 100% be a question about like one of the chambers bubbling or not bubbling. Is this good? Is this not good? And what to do. So definitely something I recommend knowing. One thing I will mention that really confused me with chest tubes is that this is the classic chest tube that you'll see at UCLA and at a lot of other hospitals. In the video, it talks about the like drainage section, the water seal, and then the suction container. There's no suction like water here. For this one, it's only this dial that's monitoring the suction. And so for the longest time, I'm like, where are these sections? Where is this? I don't see any bubbling anywhere. It's because these quarterbacks don't have it. And this is one of like the more common ones now that you'll see at the hospital. It's just the water seal here, and bubbling in that one is going to be bad because that means there's some air. So that's something that I wanted to mention because that's confused me for the longest time when I was in clinicals.
So instead of the valve, there's the dial.
Yeah, there's the dial.
So with the dial, what would be like the optimal range?
So with the dial, it depends. Most of our patients, we have it connected to -20 suction.
Oh, I see that.
Yeah, so it's a good number. It's a dial in the back. You can change it. And it just depends on like what's needed. Cool. So, just in case you're bored, here's some pictures of my dog. His name is Matthew. He's a rescue from Texas, but we found him at the shelter in San Diego. He is he's a Chihuahua Labrador mix.
Cool.
Don't ask me how that happened, but that's what it is. Yeah, he's a cutie. Very fun to take goofy pictures of him. All right, what's next? Tips and tricks, a little bit of advice for nursing school. Let's see. First thing, join clubs. There's a lot of awesome clubs on campus through the nursing school, not through the nursing school. I was part of ATD. That was an awesome experience to meet upperclassmen.
What is ATD?
ATD, little plug. Alpha Tau Delta, it's the professional nursing fraternity at UCLA. They host a lot of fun events, networking, mentoring, and it's a cool way to meet people in different areas of the nursing school. There's also NS at UCLA kind of doing similar things. Men in nursing is great. Just find a way to get involved, do some volunteering. That looks good on your applications for jobs, of course, trying to get a leadership role. So I know you guys are all working hard, you're studying, but at the end of the day, you're doing this because you want to get a good nursing job somewhere, you want to work in a certain field, a certain hospital. So have things to talk about. Have like a resume thing about a club or.
That was gonna be one of my questions. Have you seen your extracurricular involvement here at the UCLA School of Nursing in a way like not necessarily pay off, but like does it make sense now that you're out as a professional in terms of the stuff that you've learned and all of that?
Yeah, 100%. I specifically in my interviews for jobs, they talk about tell me a leadership experience, tell me about a volunteer.
So they do want to hear about that.
Yeah,
Oh, great.
100%. And even just being part of a club, you don't have to be a president of a club. You just be a part of something and show that you're passionate, show that you care. I'm sure you already do because you're a nurse. I'm sure you already have so much passion. But show that you're involved because they love to see involvement because even at UCLA now, like where I'm working, they have unit councils. There's like a performance improvement councils. There's an education council. I'm currently on the spirit committee where I'm hosting like events and doing stuff like that.
Cool.
Yeah, so like they want you to be a nurse, you want to get good patient care. They also want you to be a part of the team, you know, and helping out. And so that's a little club spiel. Befriend your professors. Your professors are not scary. I know maybe some of them, but they're all really cool people. They all have tons of really good experience. And it's just a way to get insight. You know, professors love sharing their path with you. And you can really form a connection by just emailing them and say, hey, like, I see this is the career path you took. I'm interested in it. Can we set up a meeting? And 99% of the times they're going to say yes. They're going to love to share with you their work. And that can also be a good way to get a connection, to get a letter of rec. I don't know who's applying this year to jobs or who's graduating this year, but it's something you always got to think of, especially as a student, what connections you have with different professors. The other one, take clinicals and immersion seriously. This is like the best opportunity to do real hands-on learning. School is great, but it's really when you're in the environment that you're going to be learning everything. One really big tip I would say for immersion, I know that's not going to be until winter or spring for some of you, but treat it like a new grad program. When you get there, introduce yourself and tell your preceptor, like, hey, like, I want to pretend like this is my new grad program, and at the end of this 10 weeks, I'm going to be the nurse by myself. And a lot of units, they'll have a checklist or like a week-to-week guideline for what they expect their new grads to do. Ask them for that. Tell them, hey, like, I know like you probably have new grads. What is their process to becoming independent nurses? Can I do that? Maybe they're not going to let you be the full independent nurse at the end, and they shouldn't because you're not licensed yet, but treat it like you are. And that way you're going to show that you really care, you're really motivated. And if you're doing immersion on a unit that you want to work on, they're going to be like, wow, like we've already trained them for 10 weeks. They're going to be the perfect applicant later on. And definitely in immersion, like, and clinicals, it can be scary. I was definitely very shy in the beginning. But put yourself out there. Go be that annoying nursing student who wants to learn everything. That's the only way you're gonna do it. And you're gonna get all these good experiences, and you're gonna be able to talk about them. Again, in interviews, they're gonna talk about, tell me a time where you went above and beyond for patient care. Tell me a time when you saw something you didn't agree with. And by putting yourself out there in your clinical rotations, you're gonna have these stories to talk about. And lastly, just have fun. College is a great time. Being at UCLA is a great time. There's so many opportunities. Campus is beautiful. Go hang out on like the grass area, join clubs, join like an intramural sports team. And yeah, I think it's amazing to be here. I'm happy to be graduated and working now, but I definitely miss it. So enjoy your time. Rock on. And then last thing I want to give out is Mark Flemek. This guy was by far the greatest help for studying for the NCLEX. For some reason, they just keep taking down his content. I think someone's trying to sell it and make money out of it. This is a QR code to a PDF that has like the study guide on it that he created. So I just had it in my Google Docs. I downloaded it. I put this on the QR code so you guys can have it.
Is it publicly accessible? Like anybody can just scan?
Yeah,
and
I
download?
think I put it to anyone can view.
Oh,
So you can download the PDF. Super duper helpful. He also has like along with the study guide, he has a lecture series where he's like talking and explaining the study guide. That one's pretty easy to find if you just search up Mark Flemek lectures. I think there's 12 of them on the different systems. But it's this PDF for some reason that was really hard to track down. So I wanted to share it with you guys so you can have it. It was for me my favorite study tool with NCLEX. And yeah, that's kind of it. That's the end of the presentation. I do see questions.
it's a question, yeah.
Yeah. Hi, Alex, can you talk about the interview process at Ronald Reagan? Timeline, if you the resume, let it start. You apply for specific unit. Okay, yeah. A lot of great questions. So the timeline for me was, I believe the application was in March. In March, you submit your resume, your letters of rec. You do apply for a specific unit. You can put a secondary unit, but I know for the cardiothoracic ICU specifically, if your secondary unit is this cardiothoracic, they probably won't consider you. They want you to be top of the line, like this is like the one you want. Other units, they'll give you your first, second choice. So just know what you really want and put that as your first. But some units will have like a secondary option also. Let's see what how many interviews. I just went through one interview. I know some people went through one or two on different units at UCLA, depending on the management and how many different people applied. What is the new grad program like? It's awesome. They really walk you slowly through transitioning to practice. They have different mock situations where they'll like put you through like a simulation of a code or simulation of a rapid response in this like off unit training site. And they introduce you to all the other new grads. They do different online education. And they also have a really cool mentor program. They'll set up all the new grads with a mentor from a different unit just to talk with them to, like ease them into the program. And it's just super supportive. Everyone's really nice. I don't have experience with other new grad programs, but this, I couldn't have asked for anything more. I thought it was really awesome. Hope that answered all
Your new grad program. Oh, new question.
New grad program is roughly 10 weeks. Is it probationary? So every unit's different. But the new grad program itself is 1 year. I actually just officially graduated from it in September. Yeah, very exciting. But your preceptorship, where you have another nurse with you, is unit dependent. I was with a preceptor for about 10 to 12 weeks, where it's like me and someone else before I'm by myself, independent. I know some of my friends in other units had a preceptor for like 6 to 8 weeks. And it's really dependent on how you're doing. They're very flexible with if you do need more help or you do need more guidance, they'll keep a preceptor with you for a little bit longer. And probationary, I think technically once you hit your 6 months, you're not on probation anymore. Yeah, and then you're like a full-time employee, you get a little pay raise, it's exciting. And yeah. Any other questions, feel free to text them in the chat or to say it out loud. I can also put my phone number in the group in the chat if you ever want to text me. So here's my phone number. Feel free to text me anytime you have questions, just want to talk, need advice, or if you're applying and you want me to look at your resume or you want to go over through some interview prep, I'm more than happy to help. It is a daunting process. It's a little scary. There's a lot of things to consider. So anything I can do to make it easier to kind of help you out, please let me know.
Any other questions, anyone? About anything?
Hey, Alex, thank you for coming over and talking about your experience. I was just curious, where were you for your immersion?
So I was actually on the 7 ICU for my immersion, which made it a lot easier of a transition as a new grad. So it was really cool to be able to be there for 10 weeks and see like, okay, this is actually something I like, something I'm interested in. And also just learning that before the new grad program really made it easier learning process. What is immersion? Is that your awesome? Great question. So immersion is your last year. If you're a American, it's in the winter quarter, and if you're a BSN, it's in the spring quarter. It's where there's no classes, and you're pretty much just following a nurse's schedule and going to work with them every day. It's 10 weeks, it's the whole quarter, and it's pretty much your first time like as a real nurse. You're working 3 days a week, you're there the whole 12 hours, and it's really cool. And you'll have the choice between different units, and hopefully during your rotation, you kind of get an idea what you're interested in. And yeah.
Would you say, and I probably already answered this, but would you say that your immersion and or clinical rotation kind of like shaped what you wanted to go into?
Yeah, 100%. I think during my rotations, I was able to see different acuities, different like systems. And then I think immersion specifically, because I spent the most time on that unit and made the most connections with the staff, I was able to really develop a passion and an interest for my unit. But I don't think I knew all that until I went through everything. It's hard to know what you're interested in with patient care until you've done it, until you've seen it. Yeah, awesome. If you're interested in that area, definitely like try to get an immersion spot there. I know each year they kind of switch up how the immersion placements go. But if you're interested, talk to some of your professors who are in that area, get their advice too. I'm one resource, but UCLA School of Nursing has so many resources. Yeah.
I have another quick question. I know it may be a silly question, but let's say you're placed in Ronald Reagan Med Search for your immersion. Once you have that placement, that's where you're going to be staying for 10 weeks. You're not going to be rotating elsewhere throughout Ronald Reagan.
Correct. That's just for your immersion, but you'll have rotations through your med-surg A, your med-surg B, med-surg C. You're gonna have your pediatrics, you're gonna have your maternity, you're gonna have your psych. So you're gonna have a ton of rotations all the way before immersion. So don't worry about not getting that experience for your immersion. You're gonna still see a lot of different areas of the hospital. You're gonna go to multiple hospitals. I went to Torrance, I went to White Memorial. People went all over the place for their rotations. So,
Thanks.
mhm.
Like, is that what like clinical rotation actually means? That you go to different sites?
Yeah, and it's really cool to see different hospitals and different workflows and just see how it can be different in different places. Mhm. Yeah, thank you so much. I appreciate it. It's been a wild journey, going through the ebbs and flows of being a new grad, but 1 year out, I feel a lot more confident. I'm a lot more comfortable. And it's just part of the natural process of learning and becoming a new nurse. I'm very excited to see what my future holds. I'm very excited to keep getting more involved in the unit. I really, really want to give back and help out because I had a lot of amazing mentors when I was a student, and even when I was a new grad. And I think it makes a really big difference. So anytime you want just to talk to someone, need advice, have any questions, please, please, please reach out. Let me know. I'll do what I can to help. And if I don't have the answers, I can help find someone who does. And with that, thank you all very much for coming to this presentation. I hope you learned something. And yeah, good luck.
Yeah. Thank you, Alex. Yeah. Thank you everyone for joining us. Please look for this video in our UCLA School of Nursing YouTube channel. We will be uploading later this week. Thank you, everyone.